Mick Applicator.
This is the final stage of the implant.
To remove the protective sheath.
Methods used to deliver loose seeds will vary from one centre to another. The 4D brachytherapy team at Guildford use the Mick Applicator system. This system uses a combination of empty Mick needles, cartridges preloaded with oncoseeds, and the applicator itself. With the needle positions already marked on the ultrasound, all the empty Mick needles can be inserted.
Okay, so the first one is in little. Do you want me to come? Yeah, I do.
In an identical process to the strand needles, the ultrasound probe sits mid-gland, and the Mick needles are all initially inserted using the transverse view. Typically, the nomogram will suggest between 5 and 7 needles for implant.
Happy with that one? Yeah. Okay. We're now going to cut back to the longitudinal view. Firstly, I'm going to line the prostate up with the base plane on the screen, and then the planning computer can then line up as well. So we are, again, all in alignment, all in sync. And that's looking just great.
With everything lined correctly, the final task of delivering the loose seeds can begin.
This cartridge has 15 loose seeds in. I'm going to insert it into the Mick Applicator. Robert's now going to focus on the first needle. I'm going to just advance the needle up as far as I can towards the base of the prostate.
Initially, the Mick Applicator is dipped in sterile water to stop it jamming with clotted blood.
Okay.
The loose seeds are implanted using the same two-person technique as the strands. Again, the clinician operating the planning computer controls the ultrasound, ensuring that the planted seeds are marked accurately.
The loose seeds within side of the prostate allow us to have great flexibility exactly where we place those seeds in relation to the urethra, and particularly downstream at the apex of the prostate, so that we don't overtreat those nerves and run the risk of our patients developing erectile dysfunction.
Level 35.
Hang on, Amanda.
It's here that the Mick Applicator is most effective at getting the radiation dose into the prostate with these critical seeds.
Level 45.
Normally the stranded seeds are at 1 centimetre spacings, whereas a Mick Applicator allows us to have 2 seeds right together, and then a large gap, and then perhaps another 2 seeds, and then another gap. So it allows us great flexibility, and we need that flexibility because we may wish to place those seeds in any particular place to optimise the dose to the gland.
Level 10.
Well, the difficulty with a strand, its length is fixed, so you can get one end right, but actually sometimes the other end is going to be just out of position. So you normally can't put the seeds any higher into the prostate, or they'll be lying in the bladder. So what tends to happen, they tend to come out.
35.
Not only can I be very tight on getting the seeds right at the base of the prostate, but I can also get exactly the seeds at the apex of the prostate.
This will be particularly important when there is a very mobile gland to deal with. If there are slight movements, these can easily be followed to give a dose that conforms to its shape and contour.
Nearly done, team.
4 seeds first.
It does mean that as we're inserting, particularly the loose seeds, if we see that the prostate has expanded and is a little bit longer than what it was at the beginning of the procedure, we're going to put some seeds in there and cover that gland.
We do really need to look at where the prostate is and how the prostate's moving. We actually make sure we treat the prostate gland rather than just blindly following a plan and hoping the prostate is where your coordinates say it is.
It's very important that we cover what we see, as it were. And it sounds simple, but it's an important lesson.
Finishing off the final few seeds, the implant is complete.
Okay, so that's all the seeds implanted into the prostate gland. This case has taken 42 minutes, as it happens, to perform. We're just going to finally check the dose planning computer, and that the doses to the prostate are just as we had hoped.
The dose in this situation is excellent. I'm just, at this moment, just flicking through from 5mm cut to 5mm cut, just to make sure that our 145 isodose is fully covering the prostate, which it is. I can see that my D90 is ideal and the urethra and the rectum are getting very low doses, so we're pleased with all this and we're going to finish the procedure here.
In 4D brachytherapy, the expected doses are V100 above 95%, V150 between 55 and 65%, D90 between 155 and 185% Gray, higher than the prescribed maximum of 145 Gray, as it will reduce slightly by the time of the post-implant dosimetry CT scan. The U150 for the urethra should be below 7%, and the R100 for the rectum less than 1 cc.